Welcome to this edition of the Dean's Video Newsletter. Today I'm actually coming to you from the History of Medicine Library, so if you're wondering about these books that are behind us, this is a rich collection that we have here. Before we start, I want to welcome everybody back to this academic year. We've just finished having our white coat ceremonies for our dental students as well as our medical students. And as I look around the campus, one can't miss all the other students who have joined us as well. So it's a busy place again. Welcome back to the school. It's going to be an exciting year for us. There's lots of things that are going on. I want to touch base on a few of those as we go through our discussion today. There are a couple of key ones, things that you're going to start to see some changes with that I think you should know a little bit about as well. So first off, our School of Public Health. So the Interfaculty Program in Public Health that I've talked to you about before is rapidly becoming a reality this year. If you drive and happen to look at the corner of Richmond and Windermere, you'll see a brand new building that's being put up. A lot of people wonder what that is. Well, that's the building. That's the one that is going to house our School of Public Health and our Center for Family Medicine Studies. So it'll be a 4-floor building. On the top floor will be our School of Public Health. That's being led by Dr. Mohammed Raab, who joined us earlier this year. I introduced him to you somewhere around December, January. He and his team have been working extremely hard to develop the curriculum. I must say, one of the pieces on my learning curve is I had no idea the complexity in bringing an entire new program to fruition. Our plan is that we'll be welcoming our first students in September of 2013. I got asked a lot about how are we doing on our strategic plan. If you go to the website, you can easily click on the update of the strategic plan. It tells you what we're doing, what our 1-, 3-, and 5-year measurables are, as well as our 10-year measurables. We're moving along extremely well on all of those. I think a perfect example is to look at what's happening on our research front. The research office, now helmed by Vice Dean Denise Figlitz, a lot of good things happening there. New research programs, initiatives, mentoring, programs being identified, lots of support within that office, and we're starting to see that translate into our grants going out in greater numbers. We'll look with a lot of keenness to see whether that starts to move forward as well in success at those levels. As all of us know, it's a very difficult time worldwide right now and in Canada on the research funding level. So the impetus that we've put forward there and all the new initiatives I think are going to pay off really nicely. So that's happening as well. On the aspect of our relationships with the hospitals in our community, Margaret Steele, who's the Vice Dean of Hospital Interfaculty Relationships, is doing a lot of work on developing our academic health sciences network and what are those relationships with not only the hospitals here within London, but throughout our entire community. Keep an eye on that. There's a lot happening there, and the website will be telling you a fair bit along those lines. So as we go through the course of this year, I'll keep you up to speed on all of those different areas. We are looking at the issues of what the structure of our school is like. We learned very recently we're not the only ones doing that. I get a question about, as we're looking at how do we better deliver everything from the services to our communications through to our educational paradigms, and how do we move our resources to strategically strengthen us in areas. We're about 1.5 years ahead of the curve on that one, but it's happening everywhere in Canada right now. Every school, every medical school is asking the same questions. So I think we've been well poised to move forward on that, and you'll start to see some of those initiatives as well. One of the big ones as well that I get asked about is what's this year going to look like on our global health and internationalization vantage. A lot is happening there. We've spent the last 2 years developing a white paper on internationalization and globalization. I've mentioned that a couple of times in the past. That paper now has gone forward to our senior executive for approval. It's a very comprehensive document that talks about what are we as a school doing internationally? Under what circumstances would we be in another area of the world? And is that something that's globalization? And so by that we're really talking about, are we doing things that speak to the delivery of healthcare, the sort of Marshall McLuhan concept of a world without borders? But we have that in healthcare. How do we actually provide help and assistance in areas that are developing parts of the world, while at the same time doing it in a manner where we learn, where our students come back learning a great deal, where learning different ways of practicing medicine or science help strengthen what we do here. So that's the true globalization kind of component to it. If you think about internationalization, not to simplify it greatly, but it's simply put a dollar value to it. If we actually have a relationship with another country where we are providing a service to them, and there is a dollar value with that, or we are sharing intellectual property, or we are developing research programs, those things take on a slightly different color. They really are built in much more structured formal agreements. So our white paper speaks to how do we do all of that. And we clearly can't do that everywhere. We don't have the resources, either economically or from a human resource point of view, to that. So we have to be very strategic. We're looking at areas such as, for instance, working in China, working in Brazil, in the Middle East, developing stronger links with Wayne State in Detroit on our pharmacology programs. So keep an eye. I'll be telling you a lot more around that. We are in the midst of appointing a special advisor to work specifically with our decanal group to help advance all of those initiatives. I'll be introducing you to that individual very, very shortly, but I'll just wet your whistle for it today. So I hope over the course of the next year to make sure I keep you really up to speed on everything that we're doing, and look forward to chatting with you again. And again, to everybody, welcome back for another semester or another term. I look forward to seeing you in the halls. Take care.